You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome back to the Active Mom Postpartum Podcast. We are lucky enough, as we are friends of doulas here on the show, to have KRISTIN Revere from Gold Coast Doulas in Michigan come and chat with us about all things doula, pregnancy, postpartum, all that good stuff. So, KRISTIN, welcome to the show.
Thanks for having me, Carrie. I'm excited to chat with your audience.
So tell us a little bit about who you are, how you got to be a doula. And a lot of people don't know what doulas do. So maybe we start with the basics.
Okay. So my background is in advertising sales, many different forms, and political fundraising, nonprofit fundraising. And when I had my daughter later in life, I was working on a governor's race, and honestly, just had no ambition to work in the maternal health space until I had kids and experienced everything myself.
Happens to a lot of people.
Yeah. And I didn't know what doulas are. My daughter's almost 14. She'll be 14 in January. But I, had a lot of planning put into place. And everything from taking a Lamaze class to switching providers to finding a provider who was on board with my wishes for an unmedicated hospital birth. And, read all the books with my husband, who had some fears about my wishes because his prior marriage had an emergency cesarean and his daughter was in the NICU for multiple weeks. So, his experience was filled with a lot of trauma. And so my wishes just seemed to be counterintuitive to what he expected. Like, he thought I might want to go to the hospital and get an epidural right away, maybe. But my plans were a bit different. So once he was on board, everything was great up until 37 weeks. Then I developed preeclampsia and was on bed rest and had a lot of fear, and talked to my Lamaze educator about options and, my midwife team as well. And so I luckily avoided a lot of interventions, but long story short, my daughter ended up in the NICU for 4 days with glucose issues. So all of my breastfeeding planning with taking the classes, it fell aside. I was pumping in my room, going back and forth to the NICU, and my daughter started with an IV and then formula, then my pumped milk, and she didn't want to breastfeed once I got her home.
Aww.
So I involved a lactation consultant. I went to the hospital and met with consultants there. Still didn't work. So I found one to come to my home and was able to finally introduce breastfeeding after a lot of struggles and support groups. And so I became passionate about breastfeeding advocacy after having my daughter, and helped with my background in politics, had elected officials come and speak and help create a rally. And I met doulas at the rally. And so my kids are 21 months apart. So by the time I was pregnant with my son, my first call was to one of the doulas that I met and hired her early. And my goal was to prevent preeclampsia. So I did prenatal yoga all over again. My nurse midwife had me swimming all throughout pregnancy. I was very active and saw a functional medicine doctor and a naturopath, and really did all the things to assemble my dream team. Took Lamaze all over again, as I'm a planner, and had a much better outcome. So a very quick, unmedicated birth, no interventions. And my son did have some breastfeeding struggles as he had a tongue tie. So we had to get that revised. I saw lactation consultants all over again. I did develop mastitis, so needed to bring in expert help. But other than that, when I was pregnant with my son, I started, I read a book called Sacred Pregnancy, and I signed up for a training that during my pregnancy. So when my son was 4 months old, we all went to Virginia and I got trained to be an instructor. So I started teaching childbirth classes, figure to be a hobby. But then my students wanted me to be their doula. So I decided to go to Florida and get trained to be a doula, and thought I might take a client or two, see how I liked it. And I fell in love with the work of being with women and families in this vulnerable time, whether it's baby 1 or 4. To me, it is such a sacred time. And I felt like my gifts were being used in a completely different way. When I worked in politics, I was all about getting women to feel confident to run for office before they're asked and to win, and certainly to raise money as a fundraiser.
Mhm. That's a very DC story, by the way. Like, I was like, yeah, okay. Yeah. We have so many women that have that similar story that they've gone on and kind of left the hill.
Yeah.
And now, like, they're yoga instructors or they're doulas, or, I that's a very DC story. And for somebody, you did all this while you were living in Michigan. I'm like, really? Are you sure you weren't here?
Right. I did go to DC when I worked in politics many
Yep.
times for fundraising trainings, and yeah, I did worked on some federal campaigns in the volunteer capacity. So I get the culture. I love DC.
Very different vibes. Very different vibes.
Yes. A
Now, a
lot of
lot.
the type A personalities like my own. Yeah.
Yes, no, when you were talking about, I like to have things a certain way. That's very much how we do things here, which is why one of the reasons that I usually recommend a doula, because I'm like, how strongly do you feel about how this is going to go? And if
Right.
you have strong, because we have a lot of geriatric, and I can say that being one, pregnancies here. My average new mom patient is like 38 to 42. And
Yeah.
so when you have this situation, you have somebody that's been very kind of able to control things their entire life. I'm like, if you want support, hire somebody that their job is to attend to you, that you don't have to worry about shift change, kind of all this other stuff. So yeah,
100%.
we're huge fans here. A lot of people don't realize that the mother of the doula profession was a physical therapist,
Yes.
Penny
I
Simkin,
am
who
aware.
she
Yeah,
just passed away
she's
this year.
amazing.
Yep.
Yeah.
I actually,
Legend.
um, we had Penny at a conference for pelvic physical therapists a number of years ago, and in Baltimore, and she needed to
Okay.
get back to Arlington. And so I gave her a ride, not realizing who she was. So we're just like
Oh,
chatting for, an hour. And I have this like world renowned, mother of the doula profession in my car.
yes. Amazing. I'm so jealous. Oh,
No, she was lovely, and I was like, "I have no idea who this lady is." I just listened to her. She sounds delightful, a lot of good information, but yeah, I had no idea. I think this was pre-kids. Um,
okay. So yeah,
yeah,
it
but
wouldn't have had as much impact pre-kids,
no, but I
but
did my first pregnancy, I did get a doula, and she was a rock star because she was also a midwife in the UK, and she caught a lot of things before. But like generally, I think one of the first things that people ask me when I bring up the question of, are you going to have a doula? They're like, I don't know what that means. And
right.
what is that going to do for me? What does that promise for me? Because I think it's much easier if you're that person that you're like, I'm going to have the team set up, because you're going to do that. You're going to check that box. But for that person that has no idea what it is, what do you typically say to them? And how would you recommend that somebody goes about kind of figuring out what, if that's going to be a good match for them?
Right. So there is a lot of, information that is confusing out there. People may think a doula is a midwife. We are not medical. We don't catch babies. We clients hire us for 3 primary reasons at a birth, and that would be for the informational support resources like physical therapists, pelvic floor physical therapists, mental health, car seat safety, like understanding your options with cord blood donation and banking, all of the things. And then certainly that coaching or emotional handholding support, depending on the preference of the individual client. And then a lot of our work is hands on and physical. So position changes during labor, and certainly the physical touch if a client prefers to have hands-on. So that could be labor massage, hip squeezes, counter pressure, and being there to also support the partner or anybody else in the room. We work as a team with the midwife or the OB and the nurse and any other family members or friends who are part of the birthing team.
So if somebody's never had a baby before and there's their
Yeah.
first time through, I think a lot of this stuff, it just kind of sort of glosses over and they're like, what does that mean in the moment? What does that look like from those days? Um, what does that contact look like up to the point where either you start going into labor or an induction? And then I think the other thing that comes up too is um, there's the question of, if I have a doula, does that mean that I'm anti-induction or anti-intervention or things like that? I feel like there's some gray area there where people think, okay, doula's like all natural, only this, but they can be helpful as far as kind of guiding that decision-making process as well.
Absolutely. And some doulas do have a niche. So they might focus only on home births or unmedicated, or they might focus on VBAC clients only, vaginal birth after cesarean. My agency prides itself on judgment-free support, no matter how you birth your baby or where, parent, and feed your baby. So we are not slanted in any way. We are there to provide support for families, as long as, of course, they're doing things safely. We would never attend an unattended birth. So we would also, support safe sleep and, proper feeding. If it's a formula feeding baby, we're going to follow instructions. But other than that, we won't give judgment the way well-meaning family and friends may.
When somebody's looking for a doula, is that one of those things like you get your positive pregnancy test and that's the first call right up there with pediatrician, pool membership, and childcare? Like,
Yes. If
when
you
should somebody make the call?
Great question, Carrie. So the earlier the better, because that support, if you hire your doula early in pregnancy, then you have the doula's support and resources and connections. If you're having a bad day or you just left your prenatal visit with your provider and want some resources to have a discussion at the next appointment, then your doula is there. My agency is large enough that we can usually accommodate a last minute hire, but the relationship won't be as strong. Like if you go into your labor space, oftentimes you don't know your nurse. You need to attune. The provider that you saw throughout pregnancy may not be the one at your birth, but you know your doula. So the earlier you hire, the better. And if you want your pick of doulas, again, we get booked
Right.
up quickly. We can only take a limited amount of clients per month in order to make the burst that we commit to. And so if you want an experienced or a particular personality, then you're better off hiring early. Typically, a client would hire in the second trimester.
Gotcha. If just as a back end thing, like how do you guys figure out how many clients to schedule? Like, let's say you've got four women and they all have the same like due date within like 10 days or so. Would you distribute it across four doulas, or you just go rock, paper, scissors, or what happens?
So it depends on the doula's availability. Some doulas on
Mhm,
my team are nurses and have other jobs,
mhm.
or it could be a part-time nanny, or they may be a postpartum doula with my team as well. So the way I have it structured at Gold Coast is some doulas who have a lot of availability will act as a solo doula. And if they have another role or job, then they will share call with another doula on the
Mm,
team. But my entire team is there for backup. We all practice in the same way. They're all certified, insured, have, additional trainings that would keep them to my high standards that I have at Gold Coast. And so when I was a solo doula, I did backup for other doulas. They did
mhm.
backup for me. And you go in and someone could have completely different background or
Right.
way of doing things. And so it does give a lot of reassurance. So honestly, it just depends on the individual. When I
Mhm.
started out, I would take 4 to 6 a month. And now that I'm running a busy agency, just released a book, I limit to about 2 shared a month and some blocks of time where I'm not taking clients. But I'd
Gotcha.
say on average, most of the doulas on my team take about 3 a month.
Mhm.
Some take more, some take fewer.
So the likelihood of you getting multiple calls at the same
Yeah.
time.
And I find it's better to pair due dates that are close together to avoid 2 going on the same day rather
Mhm.
than spaced out 3 weeks. You might have someone go 5
Right.
weeks early or at 42 weeks. And so I have found, because we track everything, and
Yeah,
very few clients who are due on the same day or a day apart
we're gonna go.
deliver on the same day.
Yeah, I was gonna say it must be an interesting scheduling challenge.
Yes, it is, for sure. Unpredictable. Even with
Yes,
planned surgical births or planned inductions, baby may come before that planned day.
right. Yeah, they kinda have a mind of their own for sure.
Right.
Um,
Or the mother's body might, have something going on like
yep.
preeclampsia, like my own
Yeah.
situation.
Yeah, no, that's for sure. Um, where I am here in the DC area, we have obviously a lot of hospitals, and
Yes.
some are anecdotally more doula friendly than others.
Mhm.
Um, Speaking to your experience, what are some traits of a doula-friendly practice, hospital scenario, nursing situation versus one that may not be as supportive? Just so people understand what that looks like, because I think the average person, if you haven't been in that scenario, you have no idea kind of, and then you're just relying on people's, birth stories, which sometimes isn't great to listen to before you've had your first kid.
Right. So it honestly varies. I have found that by focusing more on creating change within and, getting to know administrators and, the nursing team and certainly foundations of hospitals, I've been able to create strong relationships within hospital systems, even for hospitals that may not be as natural
Mhm,
or doula friendly as far as their policies.
mhm.
But we, experience all doulas experience quite a bit of stress during the pandemic when,
Right.
visitors were limited. Some hospitals allowed doulas, others did not. And, unless there wasn't a partner, then we would count as the partner.
Right.
But I was fortunate to have a governor that, even during our stay at home order, doulas were considered essential workers. So outside of one small hospital, we were able to work the entire pandemic by
Mhm.
showing certification, by being professional. So it depends on, how much work you have to do in the culture, but I don't want my clients to switch providers because of me or
Mhm.
switch hospitals. So if there's extra work that I need to do to
Mhm.
develop a relationship with a particular provider or hospital, I will do that as owner of the business.
Gotcha. Do you have, because I know here, typically people are going to go have their OB visit first, kind of establish that. And then I think typically the doula decision comes later. Usually, what I'll recommend to them is like talk to who your provider works with, or, find a doula provider that's used to working out of that facility. That way, it just makes it a lot easier. What recommendations do you have as far as if somebody's decided, "Hey, this is something that I wanna look into," how they go about that process?
Absolutely. So certainly asking their provider, like having that conversation in a prenatal visit of, hey, I'm thinking of having a doula. What are your feelings about doulas? Have you worked with any? What was your experience? Do you have any
Mhm.
recommendations? And see what they say.
Yeah. I also make it akin to dating. So if I have patients that come in and they're like, "I don't know if I want this or not." I'm like, "Okay, here's the deal. This is gonna be like finding a nanny too, if that's what you wanna do, is call them up, have them give you their spiel, talk to them. You're either gonna be interested or you're gonna be like, "Ooh, that is not me." But, like, there's
Yes.
nothing that I can say or anything that you can read on a pamphlet that's gonna be like, "Yeah, that's my person." I'm like, "You need to listen, you need to ask questions, you need to have them tell you kinda what that is," and it's either you're gonna vibe with it or you're not, which is so scientific.
Yes,
But
it
it's
is.
kind of like dating. Like, how do you train, providers that work for you to be like, hey, this is where we're trying to establish rapport. We're trying to answer questions. Like, how does a typical doula get trained in, you know, working in a service profession?
Yes, and some of my team members have no problem attuning to all personalities.
Yeah.
In pro doulas training, I happen to be a pro doula. There's a disc assessment and really understanding how to relate not only to the client but the partner, and knowing
Mhm.
your own personality, and for doulas who share call their partners, and how you can play off strengths and weaknesses. And I feel like there is a doula for everyone, but I can also be for anyone if I understand how
Mhm.
to relate to the individual and what their needs are. So
Mhm.
I play matchmaker's owner. I talk to every inquiry in the business,
Mhm.
and I try to find out what they're looking for, not only in experience, but also personality. Sometimes, if they're calling last minute, I have very little
Right.
availability. So, but I do suggest that they certainly interview a doula, ask questions, and make sure they feel comfortable, like warm
Yeah.
and fuzzy, because it's a very intimate time
Mhm.
and you want that connection. If you don't have it,
Right.
then there may be another fit for you.
Yeah. No, I love that you threw disc assessment in there, and the average person is gonna be like, "I don't know what she just said." Can you can you dive into that, what that is, just for the average person that may not know?
Yeah, so certainly there are so many different personality assessments, and it's understanding, if someone is a driver, I happen to be a DI, or if they're more of an influencer, so they're all like they like to get on a stage, they like an audience, they'll make a friend
Mhm.
with anyone. And the S is all about safety and security, and the C tends to be more cautious and
Mhm.
analytically minded. And so may really a C might have a list of questions for the doulas and may want to interview three or four, or may rely on testimonials, and they
Mhm.
really do their research, where an I will just feel the vibes and make a decision based on instinct, oftentimes, depending on what their secondary characteristic is.
Yeah.
But
No.
the S's, whew, I find that with postpartum doula work and doing the newborn care aspect, they are so used to serving others. They want to entertain and feel bad asking for help. So even hiring a birth doula may be difficult for them. So getting them to understand that it's important to be cared for, and they don't need to care for their doula and their family members after they've had a baby.
Yeah, talk a little bit about what a postpartum doula is, what the difference is between a that and a doula that might be with you in pregnancy and delivery.
Okay. So a postpartum doula is there, and the scope may be different based on the doula's training. Some doula training organizations are focused on 6 weeks to 8 weeks of support, that mothering the mother, very recovery focused, of course, feeding focused, household tasks during the day. They may only offer daytime support. Our doulas also have an infant care component. I have some newborn care specialists on my team as well. I happen to be one. And so that would involve an extended amount of time. We work through the first year at Gold Coast and support families, with that recovery time and sibling care and household tasks. But we also, focus on caring for baby and help families create strong systems and really prioritize sleep. So we work with a lot of professional parents, maybe physician families. They have to get right back to work, the partner that is, and sleep is a priority. Or some clients will hire us once they return to work and they want to get a good night's sleep at least a couple nights a week, and prioritize and budget for that. So it can vary. We have some clients that want support the day they get home from the hospital,
Mhm.
and others that want support once their partner goes back to work, or oftentimes it is, based on their own career aspirations, because there's a lot to juggle. And if you're on this track career wise and you've had this maternity leave and want to get back, then there's a lot of pressure to succeed. And, having that support and the sleep will help you to, succeed in the workplace.
Yeah, no, I feel like postpartum doula is relatively new. Am I wrong? Because I don't remember my kids are 11 and 13. I don't remember having that option.
Yeah, and it is newer. So there were a couple postpartum doulas in my area after I had my son who just turned 12. And we ended up bringing a training to the area when I launched Gold Coast with
Mm,
my former business partner in 2015, because trainers didn't come to the area. You had to go to other states
right.
to get trained. And so we ended up hiring almost everyone that attended the training. And we had to educate our community on what a postpartum doula is. I'm still
Mhm.
educating about the
Yeah.
role of a postpartum doula, because if people know what doulas are, it's often the birth doula, but it's the wrong impression of a birth doula, of only for unmedicated, almost crunchy, hippie,
Right.
not corporate professional. And so I am all about speaking to professionals and on podcasts like your own about how a doula can make life easier, can help you in that change, whether it's baby 1 or 4, we still
Mhm.
need support.
Yeah, no, I'm glad you said that because it was one of the things that I was thinking is back when we had our kids, I do feel like the stigma was very much crunchy, natural. Hey, you want to do it a certain way, you're going to get a doula. And there weren't a lot of them.
Right.
Whereas now I feel like, and again, especially in the DC metro area, when you have the moms that want to check the box and do everything right and have, they have plans for how things are supposed to go on the opposite side, whether or not you're kid follows that, that's another conversation.
Of course.
But to have all of those boxes checked, I mean, granted to have the privilege and, to financially navigate that, but like I feel it's so much more normal or like
Yes.
not odd. Why do you think the shift? Why do you think the change?
Part of the change is based on, you know, the trainings that are now available and the focus on mothering the mother and caring for yourself, and really introducing some traditions from other cultures like Malaysian recovery, Chinese,
Mhm.
and incorporating those in care. But I would say, honestly, the biggest shift is benefits. So many states now have Medicaid that cover birth doulas, so it makes it more accessible.
Yep.
And again, more awareness as a result of that. Michigan is one of the states that is recently Medicaid covered. And then certainly health savings and flex spending have covered doulas the last several years. I say it's about 4 years. And then there are now these employer funded benefits that cover both birth and postpartum, or maybe one or the other. And that would be carrot fertility. So there are a lot of them are wrapped on fertility benefits, Maven,
Mhm.
Progeny, and there's a certain amount of funds for a doula, or a certain amount of time for care, could be 6 weeks, for example.
Mhm.
And so that's made it more accessible. And then HR departments are talking about benefits, and doulas are part of that conversation. So many different things. Military benefits, TRICARE covers birth support. So, and some of those Christian healthcare sharing programs, I talk about a lot of ways to pay for a doula and how to look into your benefits and have that conversation in my book, Supported Your Guide to Birth and Baby.
Yeah, so my next question is, who did you guys bring in for PR and advocacy? Because that's how that stuff happens. It's not just we all rolled over and said, "Yep, we need to take care of women in the maternal era." Yes, that is kind of slowly coming along. We're having these bigger conversations, but you have to get the right people in front of the other right people, especially when there's, you know, funding involved. So was that a concerted effort by the doula organization? I don't even know if you guys have a professional. It's Dona, right?
DONA is one of the training
Okay.
organizations.
Okay.
They do some advocacy, Kappa, I mean, ProDual, all of the
Yeah.
different training organizations, but we don't have one big body that
Mm,
unites us all as doulas. And Again, some of our scopes are different, which can be
Okay.
tricky. There's not a certifying board the way your profession
Mhm.
has, or even midwives, for example.
Right.
That could be to come as more and more benefits open up if general insurance covers doulas.
Yeah.
There are already, some restrictions and, requirements to get Medicaid covered, for example. So
Mhm.
I see a shift coming. I would be for
Yeah.
national certification for sure.
Yeah, no, it's interesting. I think being in healthcare as long as I have, and then obviously living around here, you're like, if somebody's going to pay for it, somebody did a lot of lobbying, so good on them.
Yes, I agree. And I can tell you, in my time as a doula, a lot has shifted in physical therapy, pelvic floor physical
Mhm.
therapy.
Yep.
Providers didn't used to bring that up at the 6-week visit or
Mhm.
during pregnancy. And now I don't have to educate my clients as much to advocate for themselves, to
Yep.
get that referral in time to be seen. I tend to work with a lot of athletes that want to
Mhm.
get back to whatever their sport is, the
Yeah.
marathon, swimming, tennis. And so they knew about their options, but
Mhm.
my general clients needed a little education. But now they're telling me that it's getting brought up
Yep.
and it's easier to get those referrals and to figure out the system where before women suffered. They were
Mhm.
in pain, they were leaking, intimacy was difficult, and they didn't talk about it. Maybe it was
Right.
embarrassment, but now I feel like your industry, there's a lot more awareness and
Yeah.
education.
No, for sure. And I think again, there's parallels society wise. I mean, you talk about female athletes, just having women being able to show up at the starting line, competing, now actually getting paid to navigate the pregnancy time
Yes.
period. All of those things. There's a lot of things. Researchers, women researchers, researching the questions that we have. It's all been a big push at once. But to your point, like when I first went into this, 25 years ago, this is worlds. What I do now is worlds beyond what I was taught back
Yes, I'm
then.
sure.
Now, standard of practice is shifting so that we're having these conversations before women conceive, while they are pregnant to prepare for birth. We're seeing them within the first couple of weeks postpartum. We're kind of almost functioning as that like social worker. We're like, all right, do you have a doula? Do you have a lactation consultant? Do you have, pediatrician, pool membership, childcare, like all
All the things, the dream
all the
team of
things.
experts.
Yeah.
Mhm.
Having that. And so I think and again, it's probably just my algorithm and the space that I'm in that's getting much more normalized. I should hope that's spreading out. But again, I think what's tricky is sometimes it's access and availability. So, what
Yes.
if you live in an area where there's not a local doula around the corner? Like, what are the options as far as that's concerned?
So that can be tricky. What I have found with connecting with doulas around the country at different conferences and trainings, there's usually a doula even in those rural areas.
Hmm.
But is that person the right fit? Are they only for home births,
Right.
or will they support the client who wants to get an epidural right away? Where in a major metropolitan area like DC, you'll be able to find any
Yep.
kind of doula.
Yep.
So you can take a childbirth class. You could hire a virtual doula to be there with you by phone or Zoom throughout pregnancy and the labor to give you resources like physical therapy and pelvic floor physical therapy. So there are options. I have an online course called Becoming a Mother that helps our students prepare for not only their birth, but also for early parenting. And we have expert videos with pelvic floor physical therapists, car seat safety technicians, mental health therapists, all of the different experts. So they can choose what is best for them and
Hmm.
watch those videos, learn more about each of the areas so they can feel empowered. So that could be an option for someone who doesn't have access
Hmm.
to an in-person doula.
Yeah. No, I think the benefits of having all these virtual options, and that's one of the reasons I do the podcast, is like, you don't know what you don't know. And so sometimes listening to some of these things help inspire questions that you might have, and things you might want to look into. But obviously there's the opposite side of that, is like there's so much information out there. And if a woman either does not have access to a doula, or maybe not the resources to be able to obtain one, does that ultimately make them feel like they're less likely to have a successful birth or things like that? I mean, it's same thing with, we have the same question for ourselves. Like, if you don't have access to a pelvic floor physical therapist in your area, in person or otherwise, does that put you at greater risk? And the good news is we don't have any data one way or the other. I mean, obviously women have been, having babies for a long time, and
Right.
we're not the one sole factor that's responsible for your success or whatnot. But yeah,
Agreed.
hopefully the more information we can get out there, to at least, if people don't have access, to have some sort of free information to help guide them in kind of their decision making. So whatever experience they do have, it's the best that they can have under the circumstances. So
Absolutely. And educating the partner or any other
Mhm.
support people and having them be on board, reading books, listening to podcasts like your own or Ask the Doulas, and certainly being and understanding the physical changes in the body, the emotional changes, and how to better support that process.
Yeah, I always laugh when people talk about educating the partners, because my husband is not in medical, he's in IT. And
Okay.
so it was one of those things where, somebody said to me, look, you're not going to be in sound mind and body while you're in there. So it's nice to have backup for both of you. And my oldest, both my kids were 41 and a half weeks, and I was induced with my oldest. And the next day, so I'm sitting there, everything's pretty calm, nothing's really happening.
Yeah.
I get an email from my friend, who was a GYN at the hospital that I was currently in being induced.
Okay.
And she replied back to me. Apparently my email had gotten hacked, and she got this email that said, "Hey, I'm in London. Can you send me money so I can fly back home?" And she writes back
Oh
to me, I could have sworn I did your induction last night. And that's how I found out that my email got hacked.
no.
So the whole first day of my induction, my husband, who's the IT guy, was basically winding back and unhacking my email. So sometimes it doesn't go
Yeah.
as planned, but it was so funny that the doctor who did my induction, she's like, "Yeah, you're not in London. I know this."
Right. Wild. And so he, of course, the partners tend to want to help. So he's like, well, this is my area of expertise.
So he
As
did
we're sitting
that.
here waiting, I can help fix this email problem.
The good news was nothing really was going on. We called the doula. She's like, "Hey, you're good." He did
Yeah.
his thing. My brother-in-law came down. Obviously, there was nothing he could do. My nieces all came a lot faster than my kids. And
Okay.
then our doula came in when it was time. Unfortunately, by that point, the email was taken care of. But yeah, it makes for a good story.
That's a great story. I love it.
Makes for a good story. So, all right. So wrapping up here, um, for kind of the average person that they're thinking like, hey, this is something that I want to do. What are kind of the top tips that you have for them, to kind of navigate the process, or kind of work through this? Like, if
Yeah.
this is just like a, hey, Carrie, nice to meet you. I know you're going to have a baby. These are the three things I can tell you to help you make that decision. What would that be?
So certainly look for certifications. If you do have a benefit, many of them require a certified doula. Some doulas choose to get trained and not certify or are lay trained. And so making sure that the person you're interviewing meets not only your specifications, but if you have a coverage plan that requires a doula to be certified and carry insurance and have their own LLC for their business, then you can find that out usually in a quick phone call or on a website, even doing a search about how the doulas operate. But I do suggest an interview, whether it's virtual, phone call, or in person, to see if there's a connection,
Mhm.
and then ask them about, why they're in the work, what their passion is, and make sure it's a fit for not only yourself, but also for the doula.
Yeah, I love that. We're really fortunate here. I've got some great connections with some local doulas that I've known for a long time, and it's nice to have a group of people that were just big advocates for each other, and it really is a nice way to make a support team for a new mom, whether it's her first time through or second or third or whatever that may be. So that's great advice.
Exactly.
Cool.
Yeah, we can certainly support each other in the maternal health network and, you know, provide again resources and support because the work can be exhausting. There's so much to do. I feel like maternal health is one of the most important areas to be in right now. So, yeah, it's important to have professional support systems in place.
And kudos to you for being that person that's willing to work on weird off hours because I could not personally be a doula. I need to go to bed at a certain time. I need to wake up at a certain time. I am not that person that you can call me at 2 a.m. and expect me to be coherent.
Right. I'm always double checking my ringer and my phone. And I do share call. Again, some of the doulas on my team do solo work, but I have a partner that allows a little more sustainability.
Yeah,
Unless
yeah.
it's a repeat client, then I tend to take them solo.
I gotcha. I gotcha. Now you have a podcast as well. Tell us a little bit about that.
Yes. So my podcast interviews experts like yourself. It's called Ask the Doulas, launched in 2017. And it started out as a way to interview local experts in the birth and baby space. Then the pandemic came and we decided to take it national. So I interview authors and experts in the space. And again, as a way to reach more um, parents and even people preconception that are planning
Mhm.
and be able to give them all of the options that they may not know about, including pelvic floor physical therapy.
Yeah. And then tell us about your book.
So my book, Supported Your Guide to Birth and Baby, launched on Mother's Day, and we um, created it based on our Becoming a Mother course. So it is a comprehensive guide on prepping for birth and baby in not only, our role as mothers, but also as doulas. And my co-author, Alyssa Veneclaus, is a sleep consultant. So we have a whole
Mm.
chapter on sleep, not only newborn sleep, but also gets into toddlers and family, like parent sleep and the importance of that. And then I brought in experts in areas that are medical. So we have a pediatrician answering newborn procedures, a mental health expert contributed to the mental health chapter. And then we have a lactation consultant who's an RN IBCLC that contributed to the feeding chapter. And so we also have a VBAC Academy founder contributed to the VBAC section. So lots of client stories and doula tips throughout, and then resources if our readers want to learn more about a particular topic.
Love it. Now, I think the more information out there's stuff that's going to speak to whoever in whatever mode that you listen to information or take in information. So that's great to
Yeah.
know.
And we talk about apps and podcasts, and I know we'll have to have new additions because, as you know, everything changes. So,
Yep.
but as of right now, it's as comprehensive as it could be, and it's available on Audible and Kindle version, paperback, and hardcover, and obviously on Amazon, select booksellers, and all of those local online bookshops.
I've recently gotten into like Audible and listening to books while I run. I've gotten through so many more books because in the evening I'll start reading and I get maybe 2 pages in and then I go to sleep. So it takes a really long
Same.
time to get through a book.
Yes, I consume so many books through Audible.
Yeah.
And, whether it's doing like folding laundry, household
Mhm.
tasks, I'm in the mode of like constantly driving, picking my kids up from sporting events, practices, activities. And so in the car, I listen to audiobooks.
We're in that season.
Yes, for sure.
We're in that season. All right. So on that note, at the end of every episode, we have a couple questions. So what's a book you're reading or podcast that you're listening to right now?
Oh, so honestly, I am back to basics and looking into the birth partner and there are so many different resources. So the first 40 days, and yeah, and I have been consuming a lot of podcasts like your own because I've been guesting on them. So I like to listen before I get on a podcast. And so again, just between audiobooks and podcasts and yeah, all of the things. It's just a busy life. So I would like more time to read, but once I'm off call, so I should be off call for a little bit in January, I plan to read a little bit more.
There you go. I like that. Every year in the fall, I start rereading Catherine May's Wintering. So I read it by
Ooh,
month. So that's a good tip for you. And then it's also we're prime time in the middle of British Bake Off season on Netflix. So if you're looking for any, it's very mellow. It gets you in the holiday spirit. Little jokes, levity, take you out of the seriousness of life. That's a good Netflix follow
I
too.
need that right now. Thank you for the tip.
Sure. We sometimes you gotta get out, like, I waver in and out of, like, sometimes I'm all into, like, professional reading and papers and things like that, and sometimes I gotta pull out and,
Yes.
watch Love Is Blind or something stupid like that, so
But wintering is such a great tip, especially for those of us
that's a good
that
one.
live in the
It
colder climates.
Yes, send your snow our way, please. Thank you very much. For you, favorite activity, you've got a teenager and a tween, favorite activity since becoming a mom? And it doesn't have to do with your kids if you don't want it to.
Okay. Well, certainly, creating family traditions
That's
is
fun.
so important to me, trying to keep our busy family at the table and eat our dinners together, even if our
Mhm,
schedules are a bit different, creating holiday traditions that might be different than my family's or my husband's.
mhm.
But walking and having family walks, we have a dog, a toy poodle. So going on walks together and going to the dog park and talking. But honestly, I find that especially with my teenage daughter, that alone car time and
Yes, it's
turning the
key.
podcast off, yes, and
Mhm.
having those conversations, I get more out of 15 minutes with her
Yes.
than I do at home.
Yes, especially the boys. So, yeah. No, my
Yeah.
son is very much that way. Sometimes he'll open up on the dog walks. My daughter and I spend a lot of time going to activities. So, and she's kind of like an open book, so I get a lot from her. But him, it's all he can't look at me. He has to be adjacent to me, and then
Oh,
we're fine.
funny. Yes. So my kids are the opposite. My son he's very emotionally in tune and he loves to tell me everything.
Oh,
And
that's
my
funny.
daughter, it's harder to get her to open up.
So see, you
Yeah,
get what you get sometimes.
right.
All right, who's someone in your space, your pregnancy postpartum space that we should know about? Who's somebody that you're super interested in right now?
I mean, I am certainly interested in what Miranda Bauer's got going on with postnatal nutrition, and
Mhm.
she's got training programs and a book and her own podcast. So I find that there's so much focus on nutrition and pregnancy, but
Mhm.
not as much after having baby. And
Yep.
especially if you're breastfeeding, it is, you get so depleted after giving birth. So I'm very inspired by the work she's doing in the space.
Yeah, there's a lot of good conversations, especially happening in the female athlete space about navigating that, REDS, energy availability, kind of all of that with the lactating mom. So yeah, I think that's gonna be big pushes for it in the next few years for sure.
Yes.
Cool. All right. And then last one, what does it mean to you to be an active mom?
It's important to move our bodies and even if we only have 15 minutes, like my son and I have this tradition of doing the turkey trot together, so that's coming up. And he of course is faster than I am at this stage. He's in football and basketball and
Oh,
runs
okay.
track, and so he has to eventually leave me behind. But doing activities with your kids is also a way to bond and connect.
Yep. Yeah, my daughter and I, we do that too. We've got that coming up, and it depends on if she's had like Girls on the Run in the
Oh,
few weeks
yes.
before, and if she has, we're pretty good. If not, if it was just swimming and like field hockey or something like that, we take our time. We enjoy the spirit of the of the
Yeah,
race, and there's so many people. It's not like it's a race anyway, so we just
right.
enjoy the costume.
Packed.
Yep, 100%, 100%.
I love it.
All right. If you guys would like to know a little bit more about Gold Coast Doulas, you can find them on Instagram at Gold Coast Doulas. Kristen, thanks so much for being on the show and sharing a little bit more about doulas.
Yeah, thanks so much for having me. It was a blast.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at KRIPagliano.com. This podcast reflects the opinions of Dr. Kari Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.